1, 2, 3.
While our weekly shows are edited to time for broadcast, our members and podcast subscribers, in addition, receive access to the full uncut conversations. Enjoy listening like you were there live at the taping. You are about to hear the entire conversation from our episode titled Visions for Abortion Access and Radical Care, where we look at abortion access post-Dobbs and the frameworks for care that BIPOC reproductive justice activists are drawing on for strength and survival today. These audio exclusives are made possible thanks to our members. Please join by going to lauraflanders.org/donate. We have a goal to raise $25,000, the cost of producing one episode for TV, radio, and as a podcast. Please join us and make a donation during our May Fund Drive. Thank you.
It's hard to know where to focus. Almost 2 years after the U.S. Supreme Court decision in Dobbs versus Jackson Women's Health and paved the way for states to ban abortion outright, 14 states have passed abortion bans, some imposing criminal penalties on providers. And according to a recent tally by the Guardian newspaper, some 65,000 rape survivors in this country have been unable to obtain an abortion in their home state. The impact on people's lives, health, and well-being are huge. At the same time, there's been an extraordinary response, especially from Black and brown reproductive justice activists who are experienced serving people who were never guaranteed quality health care, let alone abortion, even before Dobbs. Many of their organizations have been drawing on traditional lineages and frameworks for community care that have much to teach all of us in this moment. To co-host today's conversation about all of this, I am very happy to welcome a special co-host. Adaku Utah is an organizer, a strategist, a healer. She's the senior manager of movement building programs at the Building Movement Project and formerly organizing director at the National Network of Abortion Funds. She's an all-round fabulous person. Adaku, I'm so glad to have you here for this conversation, which I feel could go in a multitude of different directions. There's miserable news, obviously, but also some light out there.
Yeah. Thank you so much, Laura, for inviting me to the show. You as well are incredibly fabulous. I believe that this show is such a necessary conduit to connecting folks to really clear ways to take action in these times. Thank you so much for existing. And you're right, these times when I look at the state of abortion access right now can be so overwhelming and scary and a lot. And it's part of why I'm really excited to have two of my favorite reproductive justice warriors who know exactly where to focus our attention and have been fighting for our bodily sovereignty for many, many years. Chelsea Williams-Diggs, who is the executive director at the New York Abortion Access Fund, where I've been a board member, and Elizabeth Estrada, who is the New York Field Advocacy Manager at the National Latina Institute for Reproductive Justice. And each of us are part of a long lineage of Black, Indigenous, Latinx, folks of color who've been listening to our people and paying attention to the patterns of control, exploitation, criminalization, all the different ways that reproductive oppression are impacting us along race, class, immigration status, and ability. And at the same time, we have been coming up with really, really innovative solutions that can meet us where we need right now. And so when I look at the abortion landscape, I'm filled with both heartbreak and hope. Literally, as we're speaking right now, cops and courts are increasingly investigating and punishing people who are trying to access abortion care. In addition to folks who are supporting those folks are getting criminalized. And there's also increased lack of access to gender-affirming care. And of course, the genocides that are happening in Palestine, Sudan, and Congo are destroying land and bodily autonomy. And simultaneously with all of that devastation, which is awful, we have folks like all of us who are choosing to show up and say, we're going to be here for our people. We are going to create ecosystems of care that can organize and mobilize our folks to do right by our people and not just let the state betray us. We have folks who are mobilizing their elected officials to enshrine abortion in state constitutions, and also folks raising funds on a grassroots level so that care can be met with dignity. So these times are unprecedented, and they're also not new. The folks who are on this call, like myself, who've been organizing for a minute, we've been paying attention and expecting conditions like this for quite some time, and we know what to do. We know what to do. So I want to bring their voices in right now and want to kick things off to Chelsea to actually lead this conversation, sharing a little bit about how has the landscape of abortion access shifted since Dobbs.
Thank you, Adaku, and thank you, Lara. This is such a pleasure to join you and to join Elizabeth for this conversation. And Adaku, that was quite the grounding for this moment and for all of us who are privileged to do this work in this time. So how has Dobbs changed the abortion access landscape? I think that is a question that we are still unraveling and figuring out day to day. We know that there were barriers to abortion access long before the Dobbs decision. But of course, the Dobbs decision and the end of Roe and national protections meant that there were sweeping bans and further restrictions, as well as criminalization, and honestly, just fear, further stigmatization, as well as deep confusion. So what we're seeing is people who are in banned and restricted states being forced to leave their state to access care. We're also seeing people who are in protected states still figuring out what isn't legal, where there isn't access, and of course, still experiencing barriers that existed pre-Dobbs, right? So in a place like New York, which is one of the most protected states in the country, we've seen barriers exist, again, pre-Dobbs and post-Dobbs, and that's been heightened as we see an increase of folks traveling here for care and traveling to other places across the country for care. So I would say it's caused a level of confusion, of chaos, of grief, right, from folks. And it is, to your point earlier, really showing us the power of community in spite of the failures of our systems, right? When Dobbs was decided, and really when the leak came out about a month before the decision, right, we saw in writing, right, we knew that our systems, our government was not going to uphold our bodily autonomy. And we tapped into existing community models to find that power, to find that support. So post-Dobbs has been extremely difficult for everyone, for folks who are involved in the movement, for folks who aren't involved in the movement, for folks who are seeking abortion care. And it's also been, I think, a testament to my point of community power and of community models.
What would you add to that, Elizabeth, from your perch at the National Latina Institute for Reproductive Justice?
Thanks for the question. I think Chelsea really covered it. I think that for us, a community that is non-English speaking, who are immigrants of mixed status households, for example, I'm a permanent resident where my parents are both U.S. citizens. There's always been a lack of information, quality, accurate information on sexual and reproductive health education. And now it has really just spiraled into a big web of misinformation, targeted disinformation, targeting non-English speaking communities. I live in the Bronx, so we already face a lack of access to healthcare, whether it be because of affordability or because of the abundance of anti-abortion crisis pregnancy centers, which were already targeting our communities with misinformation around abortion. But we're seeing folks that perhaps would be considered knowledgeable, who do speak English as their first language, are still experiencing a lot of confusion given that there are restrictions or bans popping up every single day. And so I affirm what Chelsea's experience is in terms of how people are receiving information or not receiving information, even in more accessible states like New York. It still is really a hurdle to get accurate information out to our communities. And so we look at ourselves as kind of a conduit to providing that to our community.
Thank you so much, Elizabeth and Chelsea, for that really robust analysis and assessment of what's happening right now and what has changed. And you all know that as organizers, in order to win, we have to have this clear assessment and pay attention to what's happening on the right. And the right has had a really long game, very strategic, very, very generational, very well resourced. They've been focusing their attention on the courts on a federal and local level. They've been removing critical race theory so that we're not talking about these multiple sites of oppression and talking about our bodies in expansive ways. They're targeting medication abortion right now, and then highly criminalizing bodies and healthcare. So I'm curious, and we can start with you, Elizabeth, what are you seeing coming down the pike around the right's playbook against abortion rights right now?
I see a lot of the same things that you were expressing. I think that, we have a particular issue in the Latinx community, given, like I said, that we're not first English-speaking people, to be, accidentally sharing misinformation. And so when you already are having to navigate a complicated medical industry, I would say even folks who do speak English find it hard to figure out what's covered under their insurance plan, what isn't covered under their insurance plan. There's terminology that one might not understand. Even when doctors talk to you, you might need to say, hey, can you explain this to me in like human terms? Because I have no idea what you mean. And I think that in that crucial moment when you're having conversations with your providers, people are not feeling empowered to ask questions about abortion because it is already a stigmatized issue. They're not feeling comfortable talking to their families because abortion is stigmatized in our communities and in our households. I often say that the first barrier to access exists in your own home, because if you seek the support of family members and they bombard you with, misinformation that they heard at their church, or with a lack of compassion and understanding, then that may completely derail you from accessing the abortion care that you need and deserve. So then let's say you do finally get the support that you need and you make your appointment, you're then confronted with an anti-abortion crisis pregnancy center that might be either in the same building or across the street from a legitimate clinic. In New York, even, anti-abortion crisis pregnancy centers outnumber legitimate healthcare clinics. And they outnumber legitimate healthcare clinics nationwide. And so we're thinking about non-English speaking communities, but then even rural communities, right? I was talking to a colleague saying that in her community in New York, they don't even have a clinic. So it is lack of information, but it is also the continued barrier of affordability. One having a right doesn't mean that they can access that care.
We're going to get into the difference between the approach of reproductive justice activists and reproductive rights in just a sec. But before we do, you're saying such an important thing. I mean, I'm coming to you today from a rural county of New York State, where we're just 100 miles away from Wall Street, but there's no abortion provider in this whole county. I don't know where anybody would go in this county to get that kind of care. Coming to you, Chelsea, this is just such an important issue or picture to paint for people, that it's not like there are places where this is easy and places where it's hard. How are you finding the situation in New York, and maybe what kind of stories are walking through your door?
Yeah, I want to, if I may, also go back to this point of kind of this playbook of the right. I think what So a few things. So one, I want to honor the way that the kind of radical right has been able to bridge connections between various issues of bodily autonomy, of social justice, right, of individual rights, in a really unique and creative and effective way, right? We see the attacks, as you mentioned, on abortion rights. We see the attacks on trans and gender nonconforming people and healthcare, gender affirming healthcare. We see attacks, of course, on critical race theory and DEI, right? And these are all coming from the same think tanks, the same funders, right? It's a very strategic approach that in many ways the left, or the so-called left, has failed to do, which I would argue, I don't always know if the right are the folks that we should be focusing on, although we have a lot to learn, right, around strategy. What I would argue is that the biggest failures are from the so-called moderate, or even from the so-called left, right? And we see that particularly, to Elizabeth's point, around stigma and criminalization and confusion, right? We see how the right has been able to bring folks on the left to really not even moderate, right? Moderate to right, right? We see this conversation around, oh, a 16-week national ban is compromise. That's politics. What? Right? That is absurd, right? And that is the failures of the quote unquote left, that is the failures of the Democratic Party for decades, right, to continue to isolate and stigmatize abortion care, which is completely connected then to this intentional confusion around, right, this idea that there are blue states or safe havens where abortion access is supposedly, just completely amazing and there are no issues, right? And that is because, again, the failures of the left, the failures of our systems, the failures of electeds and also of folks on the left to really center the experience of the most marginalized, right? To really center and destigmatize and honor abortion as healthcare, right? May I even say, abortion on demand is an okay right? Is an okay talking point, right? But this fear of, oh no, we have to be in the middle. Oh no, we can't say too much of this or say too much of that.
Yeah, I think of Hillary Clinton talking about keeping abortion healthy, legal, and rare, with an emphasis on rare. How would we do it differently, Chelsea?
Exactly. Yeah. Right. So, I mean, it's centering, again, the most marginalized folks, and it's centering an unapologetic vision of bodily autonomy that includes, but of course is not limited to, abortion care. So what that looks like is saying, okay, and to Elizabeth's point, right, this disconnect between rights versus access. So if we're only focusing on rights or even legal protections, which are important, but are just one part, right? And I think a lot of blue states have moved beyond, okay, we know we have the right, but we need to create all these other legal protections. Sure, absolutely. And we need to be focusing on access, and we need to be connecting abortion to other parts and other systems and other issues of injustice. So in New York, for example, what we've seen is,
It's okay. I just want to pick on that point that you just offered and lay down right now. The concentration, the intentionality around access is such a key component of reproductive justice, and it's a key distinction between the framework of reproductive health and reproductive rights, all three, which are really important strategies for how we transform the conditions that are impacting reproductive oppression right now. And shout out to the 12 Black women who came together in 1994, folks like Toni Bond, Loretta Ross, who coined the term reproductive justice that recenters our human right to have children, not have children, and to parent the children that we have in safer and thriving communities. And not just focusing on our ability to reproduce, but have really pleasurable and satisfying sexual lives. And I really appreciate the ways that both of you are really rooting us collectively in these traditions of centering our people as we're thinking about strategies, and not just focusing on legality, or not just focusing on individual healthcare services that are only focused on a particular kind of body that is white, that is rich, that is able-bodied, and that we're looking at systemic conditions that we need to transform and building up the leadership and power of people of color. So you're already sharing a little bit of this. How has reproductive justice, especially as you, Chelsea, who describes yourself as a reproductive justice practitioner, how does it inform your work? How does it strengthen the work that you're doing right now, especially in these wild times?
Yeah, thank you for bringing us back to RJ, to reproductive justice as a framework and as a grounding. I think it's the underlying kind of piece of all this work, right? We know that Black and brown bodies do not experience injustice in silos, right? We know that every day that we wake up and we experience the world, we are hit with all the things, whether it be, as Elizabeth talks about, immigration status, and language access, right? Adaku, as you mentioned, what does it mean to be able-bodied or not? Of course, issues of anti-Blackness, of criminalization, of course, gender injustice, and so forth and so forth. So when we think about reproductive justice, we're understanding our bodily autonomy, and we're understanding our ability to, as you mentioned, experience sex, experience pleasure, right? To have the rights and protections of our experiences, and to be able to do so without kind of siloing them from the other pieces of our lives. So reproductive justice was coined in 1994, but ultimately the founders of RJ were simply creating a framework or a term that legacies of Black women have been writing about, talking about, right, for decades and years and years and years and years. I think for me, when I think about my role as a reproductive justice practitioner in 2024, it's to take the lessons, the frameworks from all of these amazing folks and continuing to push it forward to the new and different realities of our time. And constantly going back and saying, you know, we don't always have to create something new, right? The blueprints are often already written for us, right? And that doesn't mean we can't critique, challenge, push further, but there is already so much beautiful groundwork that's been laid. So when we look at abortion access, and as somebody who works for an abortion fund, when we work with folks who are on the calls, who are telling us about their experiences, we understand that we are not saving them by giving them access to abortion. We are providing a concrete need, and we need to understand how and why that need has existed for them. What are the various barriers that are not always clear, particularly to electeds or politicians, or even folks who just aren't in this space, right? And continue to deepen our analysis and fight for all the ways that people's access to bodily autonomy are being directly attacked, or sometimes just indirectly not addressed, right? Are kind of swept under the rug. So I'll pause there, and perhaps Elizabeth, please jump in with your thoughts on RJ and how that comes up in your work.
Sure. I mean, I think you did a really good job of covering how we aim to, in the reproductive justice movement, we aim to center the people most impacted by bans, by lack of access to healthcare. And I think what most comes up for me is the continued effort to draw our point to the intersection of economic justice. And I think that that's a lot of the things that we've been lifting up today, right? If you cannot afford to go to your appointment, if you cannot afford to seek the healthcare that you need, if you are a newly arrived immigrant that is waiting 5 years to access healthcare, because newly arrived immigrants cannot have access to public benefits, they have to wait 5 years in order to access. That's a matter of life and death. And so I think that the reason that reproductive justice is intersectional is because the godmothers of reproductive justice knew that their lives were not one single issue, right? We just celebrated Audre Lorde's birthday just a couple of days ago. Someone that also, shines a light, creates a journey or pathway for us to think about the work that we're doing in an expansive way that's inclusive, that aims to bring to light stories that wouldn't otherwise be told, like those that are, migrating here to New York from places all over the globe that are experiencing, lack of access to housing, lack of access to healthcare, lack of access to healthy foods. We're seeing, the defunding of public libraries in New York City. So all of these issues are connected, and what reproductive justice asks us to do is to look at our lives in this expansive way so that we enrich and that allows us to create communities where we can thrive, like Adaku said.
It's all big picture and long term, and we're for that. We need radical transformation of so much of our lives. But I do want you to give people some tools here. If they want to implement the kind of approach to community care that you're describing, what does that really look like? I mean, the back of my head, I'm thinking, before there was the legalization of abortion, just the legalization, before there was the legalization with Roe, there were community abortion providers all across this country who were finding ways, whether it's the Jane Project or many others, finding ways to provide care at a community level with as much safety as they possibly could, given the condition of the law at that time. Is what you're saying that, in a sense, we should never have abandoned that model? That we need to take care back into our communities, into our own hands, with legality, with resources. But is that part of it, that we need to embed care, take more responsibility for the care of those in our community with all of their needs and intersecting conditions? Is that part of this RJ lesson, Elizabeth?
Absolutely. I think that we are learning now, as young people are, reflecting back to us the lessons of our leaders, like Loretta Ross, like Tony Bond, that community care starts in a women's circle. It starts in conversations that we're having. Oftentimes at Latina Institute, because we're bilingual, we say chisme is revolutionary, right? Gossip is revolutionary once outlawed, because that is how we get recommendations for a good doctor. It's also how we say, oh, that be careful with that provider because they may be harmful in X ways. It is in these community circles where we learn and hear and bear witness to people's abortion stories, which are transformational. Once you share your abortion story, I know that it was transformational for my own life to share my abortion story. So it's a return to intimate community care in trust building circles. We can only move at the speed of trust. We have to earn our community's trust and say that, we have information to impart with you. We have resources to impart with our community, but first we have to earn the trust of our community in order for them to listen, to buy in, so that we can shift culture, right? We recognize that policy and legality and the law is one avenue that we have to advance our reproductive justice, pro-abortion, pro-liberation agenda, pro-woman, pro-feminist, self-determination and bodily autonomy. And that starts with our actions amongst ourselves. It starts with sharing information. Once we've built that trust, we become powerful, and we can start with policy advocacy, right? But that is not the only way we have. Here in New York, we've been trying to advocate for the Reproductive Freedom and Equity Fund, initiated by Assemblymember Jessica Gonzalez Rojas, that aims to fund organizations like the New York Abortion Access Fund, because again, affordability continues to be a barrier. But it's also about the relationships that we've built. The reason that Chelsea and I are here is because Adaku is in community with us, right? And that's how we've learned about each other. We've learned to build trust with each other. And we know that we can hit up Chelsea if we can't get to a computer and say, hey, my homegirl Maria needs medication abortion. Can you help us out? And we tap in, right? And that's what it looks like to be in a culture of care, to unlearn the mechanisms that keep us separated through capitalism, through white supremacy. And it is a return back to traditions of the Black, Indigenous, and people of color communities, right? Whether it's chisme, gossip, information sharing, trust building, community building. Hey, I'll let you borrow $100 so you can get the medication you need. I'll take you, I'll drive you to the appointment, and I'm also going to drive you when we got to go to the ballot box to vote.
Yeah. And to add to that, there's a lot of folks who want to be in relationship with us right now. Lots of folks who want to throw down and help and support the work that we're doing. Some folks who are very values aligned and know where we're up to, have a radical politicized, whether it's reproductive justice, reproductive health, reproductive rights lens. And then some folks who are new to this, coming in for the first time into movement, trying to figure out, where can I plug in the midst of all of this mess? Chelsea, what would you say? How can folks build power alongside the New York Abortion Access Fund?
Sure. So if folks are based in the New York area, of course, connecting with NIAF, the best thing you can do is follow us on social media, of course, and tap into opportunities to volunteer, to come to events, to fundraise, mobilize your own communities if that's something that you're interested in. That is ultimately the work that we do, right? We pay for people's abortions and we need money to do it, right? And prior to the Dobbs decision, the vast, vast, vast majority of our money, over 80%, were from grassroots donations. That shifted a little bit since Dobbs, but not much, right? Most of what we've been able to do is through the generous contributions of regular community folk, right? Folk who are just like, I've got $10 a month, I got $5 a month, however much, and I want that money to go to helping somebody in my community or someone traveling to my community access care. And then the volunteer aspect, we are still a mostly volunteer run organization. But at the time of the Dobbs decision, we were 100% volunteer run. I'm our first and only full-time staff person. So we depend on the love and labor of regular folks, including Elizabeth, who volunteer on weekly shifts and help, again, their community members and folks traveling to their community to access care, which is beautiful. For folks outside of the New York area, tapping in with your local abortion fund, tapping in with other local organizations, and really seeing what's going on. And depending where you are, right, you might not necessarily have, there are abortion funds across the country, but there might be spaces that you're like, I want to create, I want to learn. And I think there's always opportunity for people to just, again, grab a friend, talk about abortion, talk about destigmatize it, and understand what the needs are in their particular community. And if they're not being met already, creating methods to make those met.
Well, just on that very point, I want to get you have an opportunity here to speak to a very broad national audience of people who are hearing about the post-Dobbs situation in a very political context. If they're not directly involved in healthcare provision, they're probably hearing about it more from politicians as a political football this election than they're even hearing about what it will actually take to address the crisis that the Dobbs decision at the Supreme Court has deepened. I'm not saying there wasn't a crisis before, but it's deeper, as you laid out at the very beginning. What is your message to them right now? This is not just a political football. It's not just about reviving Roe. I'm hearing something else, and I need you to get specific. What specifically is your message to people around the country who feel panicked or maybe feel like they're being treated like a kind of political punching bag by the politicians who bandy about the language of abortion rights or abortion access, but are not speaking your language? Elizabeth.
Well, not everybody is an activist. Not everybody is an abortion provider. But what one thing that you can do after watching the show is go talk to your family and friends about why you support abortion access. And that's what I would say to everyday people. And what I would say to anti-abortion politicians, or even those that claim to be champions for reproductive freedom, I would say the word abortion. Don't be afraid to say it. And look at the data that is clear that abortion is popular. Ballot after ballot initiative, voters in the United States are reflecting the attitudes and sentiment around abortion access that is across the board highly popular.
Including in the Latinx community?
Including in the Latinx community. It is reflective that the majority of Latinx people, Latinx voters, and U.S. citizens support abortion access. And politicians should be aware of that. Because what happened with the Supreme Court is that the Supreme Court went against the will of the people. And what we're doing now is asking people to join in advocacy, join in the streets. And if you can't do that, then at least talk to your loved ones about why you support abortion access, and try to do it with compassion, understanding, and a fierce heart, because now is the time, and we need everybody's voice.
Chelsea, anything you'd add to that?
Yeah, I think it's really important for folks to understand that the worst has already happened, and it happened under a Democratic president, right? Let's be very, very clear. Dobbs happened. Abortion is no longer a nationally protected right. There are people who are struggling to access care today. They can't wait for November. They can't wait for insert whatever date where there might be an election or a ballot initiative. And I'm not saying that those things aren't important, but we can't get wrapped up in this political football, as you mentioned. We must vote to save democracy, right? No, we need to do things today as democracy actively fails us, right? So I Roe and further, right, this conversation around restore Roe is frankly embarrassing that that's even a phrase and anyone approved that. Somebody on the comms team needs to, we can chat, right? But Roe is absolutely the floor, right? And we've been saying that, and reproductive justice practitioners and founders and godmothers have been saying that for decades. Roe was never enough. We absolutely do not need to restore Roe. And I will never get behind that messaging. And to your point, there's more. We need to create policies, and we need to create community networks that allow abortion access and other experiences of bodily autonomy and community care to thrive. So I have no interest in going back to Roe, and I have absolutely no interest in making it seem as though elections themselves are what save us, because they don't, right? We voted the right way, right, in 2020, and Roe still fell. And we can get into all the, debates around Supreme Court reform and other, voting rights and all these things that are obviously connected, but it is what it is, right? And people need care today. So again, connecting with your local abortion fund, connecting with other advocacy groups, seeing what needs exist and finding ways to meet them. That could look like letting your friend borrow money for an abortion. That could look like helping your friend find their nearest abortion provider. That could look like, as Elizabeth mentioned, just listening to your friend talking about your own experiences. And that looks like building community networks that are not dependent on the state. Because beyond just Roe, we're seeing so many other failures of our systems, right? Failures of even, again, the people we're supposed to vote for. I'm not saying don't vote, and I'm not saying that that's not important, but clearly that is not enough. So clearly we need to be building systems outside of government and state, and we need to continue to reimagine what we really need in our communities and connect those to larger issues, right? Our politicians are not going to create like intersectional policy, or perhaps they might call it that, but it often fails, right? We living intersectional lives, we being an actual community with each other, can connect these dots, because the dots are already connected. We actually don't need to connect the dots. We live, with the dots, right? And we have the power to create new models of care, and those can be both outside of traditional nonprofits and within. And I think abortion funds are one entry point, but there are many others. And I actually and curious and look forward to folks creating new pathways and new visions of community care.
Absolutely. And just want to echo abortion funds. New York Abortion Access Fund is one of over 100 grassroots autonomous abortion funds that exist all across the country and in 3 countries outside of the US, who've been working for over 30 years to provide direct service around abortion care, and also organizing at the intersections of reproductive justice, economic justice, and racial justice. So throw down with them. Find out who your local abortion fund is. Go to abortionfunds.org to get that information. And also call your legislators, demand that they fund abortion care, and also enshrine abortion into the state constitution and do better and do right by our folks. So everything that we're doing right now is cultivating the future that we need. And I am eternally grateful for y'all, for your foresight, for your strategy, for the ways that you are pulling community together to really come up with the solutions that we need in this moment to not just win, but really live the lives that we deserve right now for generations. And as you think about the future, what's the story that you hope can be told? And Elizabeth, I'm going to kick it to you first, and then Chelsea.
I love this question. I think that the future looks like a thriving community that can depend on itself, that has the resources it needs to thrive, that is free of borders, that is free of criminalization and prosecution, that looks like love expressed through justice, and that doesn't depend solely on the law and policy to get there, but rather is informed by, the folks that have taught us about abolition, about mutual aid, and about freedom. And I think that that's the world that I want to live in. That's the world that I'm working for, by any means.
Thank you, Elizabeth.
It's a heavy question.
How about you, Chelsea?
I'll say I want the story of this moment to be one of resilience, right? I think, and we've already seen such beautiful resilience from people on the front lines of abortion access and people on the front lines of reproductive justice. I want that resilience to come with new worlds, right? That, as Elizabeth mentions, are free of borders, free of criminalization and police, where folks are able to be both members of their community and parent as they dream of, right? We're so confined by so much, we can't even dream of what family and community really can look like. And I dream of a world, and I want the story of a world to be one that is deeply, unapologetically pro-abortion, right? I, again, have no patience for anything less, right? We deserve that, because being pro-abortion means you are pro-family, means you are pro-community. And I think we need to tap into our most radical potential in all ways, in our rhetoric and in our actions, in order to for this new world to be created. So yes, I want the story of resilience, of unapologetic abortion advocacy, and of community care to be written. And I think we are writing it. And I'm down to continue to write it with you all and with folks who are listening.
Adaku, coming to you. You've mentioned, it's been mentioned a couple of times, the attacks on critical race theory and the attacks on memory and the attacks on truth and storytelling. And I'd love to hear from you before we close. What's one of the stories, perhaps from the past, from your personal lineage, where you come from, that you want people to hear about how community care could look, could feel, could sound like?
Oh, I love that question. So I grew up in Lagos, Nigeria, specifically a small rural town called Festac. and come from a long lineage of farmers and witches and healers and Marxist organizers.
Good combo.
You know, but really what they were up to is creating sovereignty and really listening for each other and reaching for each other and using ritual and song and medicine to figure out how to be in integrity with the ancestry that we come from and also the future that's coming. And I actually remember distinctly when we were coming to this country, we had many circles of our family coming together, and folks sitting right in front of us and reminding us that you cannot forget who you're rooted to and who are your people. And so when I think about the future that we're rewriting, that we don't forget about each other, that we don't forget who we belong to, and that nobody is forgotten in this long fight for freedom that we hope does not have any punishment, whether it's the prisons or it's the stories that we tell ourselves that imprison us, that we actually are able to move freely in free bodies that feel satisfying in ways that are deeply rooted to who and where we're from, that not only doesn't forget people, but also doesn't forget the land.
You're nodding, Elizabeth, and I suspect you have a version of that same story you want to share. Do you?
I mean, I think Adaku said it beautifully. I think when you hear the term sovereignty, it just reminds me that our movement is rooted in bodily autonomy and self-determination, and a world in which we don't have either is not a world in which we can thrive. And it goes against the tenets of reproductive justice. So I want to build and am building with Chelsea and Adaku the world that Adaku just shared with us, that is informed by her lineage. And, you know, in growing up in Atlanta, we learned to trust Black women, and that's what I'm doing by, you know, being in this movement. And I think that we wouldn't be here if it wasn't for Black women. So, you know, I'm in for the long haul, and it's going to take all of us.
And what about your Latinx community?
Yeah, I mean,
they're thinking, what about us? What about us?
I think that I often don't, I kind of move away from that, because I know that when I follow the leadership of our foremothers, that I'm including all of us. That is not only Latinas, that is AAPI communities, that's Indigenous communities. And that is who paved the way for reproductive justice. And they thought of us when they did that. And so, you know, we're celebrating Black History Month. And the Latina community has a lot to be thankful for through the civil rights movement in this country. We've benefited greatly from it. And so I think when I say that I trust Black women, that means that I'm also inclusive of all communities, especially the ones that I'm a part of, like the Latina community.
I have to give you a chance to weigh in, Chelsea. And I will just encourage our audience to check out, there are several interviews with Loretta Ross from the Reproductive Justice Movement in our archives, along with other conversations about how reproductive justice came to be as a term, as a practice. Check out the archives. Chelsea, what about you? Is there a lineage, a story, a foremother that you want to recall when you think of doing the impossible, perhaps, or making it possible, making new possibilities for us all?
Yeah, I wasn't expecting this conversation to go here, so I will call in my grandmother. My grandmother's name is Iluminada Estrella, which means illuminating star, and it is quite the long and dramatic name, and quite fitting of her. She turned 90 years old about a month ago, and a few days ago I spent some time with her, and we chatted about her experiences, and she told me things that I have never heard. And to be honest, I don't think she has told most people. And I'm really grounded in my grandmother's experiences and the ways that she's navigated womanhood, navigated immigration, navigated navigated violence from people, violence from the state, and the way that she continues to take life fully head on and instill so much confidence and love in me. And I look at her as someone who is my feminist origins, right? My grandmother is leads our family and has taught all of us to be independent and strong women. And as we were chatting on Monday, she was a little bit frustrated with some things happening in my family. And she said to me, women must have dignity. You must have your dignity. And I would broaden that to say people, right? Everyone must have dignity, must have their dignity. And I think that is at the heart of what reproductive justice is, right? It's dignity. And all of this work that we do is rooted in the dignity of humanity and the dignity of what we all deserve.
Beautiful. Thank you all. Adaku, what a rich conversation. It's really been wonderful to be with you. Elizabeth Estrada, Chelsea Williams-Diggs, thank you for your work. I look forward to the next time we get to do this.
Thank you so much, Laura, for bringing it all together. And thank you, Chelsea and Elizabeth. Grateful to be comrades with you in this lifetime.
Thank you so much.
Thank you so much.
Thank you for listening to the entire conversation from our episode titled Post-Dobbs Crisis, Visions for Abortion Access and Radical Care, where we took a look at abortion access post-Dobbs and the frameworks for care that BIPOC reproductive justice activists are drawing on for strength and survival today. These audio exclusives are made possible thanks to our members. Please consider donating during our May Fund Drive. Our goal is to raise $25,000, the cost of producing one episode for TV, radio, and as a podcast. And if you are a monthly supporter, please consider upping your monthly contribution by going to lauraflanders.org/donate. And thanks again to all our members.